The surgical weight loss program for teens at Cincinnati Children's began more than 12 years ago as the first surgical weight loss program in the world designed especially for severely overweight teenagers. Over the years, we have evaluated hundreds of teenagers who came to us because they were 100 or more pounds overweight. We've helped them lose the weight and get healthy. We understand that surgery is no quick fix, and it's not a decision to be made lightly. But if it is something you're considering, we want you to be informed. Here are answers to some of our most frequently asked questions. Has surgery been successful for teens who are obese?
Surgery's been very effective. The majority of patients will lose about a third of their initial body weight, which generally gets them to a much healthier place.
How many surgeries have been done for teens at Cincinnati Children's?
We began offering surgery for weight loss in 2001. Since that time, we've performed over 190 procedures.
What qualifies someone for bariatric surgery?
What we look at is their motivation to change. Are they really ready for an operation to help them with their weight problem? We look at their weight. We look at their what's called the body mass index, which is a mathematical computation looking at the weight and the height. And we look at their health. So we look at whether they've developed health problems already or whether they have risk factors or risks of developing health problems that would indicate to us, really this is a medically justified operation that we're talking about.
Why do patients need to meet with a psychologist?
First and foremost, we know that being a teenager is hard enough. Being a teenager who's overweight is even more difficult for a lot of teens.
Will a history of depression or therapy hurt a teen's chances of having surgery?
No, being depressed or seeing a therapist won't hurt a teen's chances of moving forward. Really, we know that being depressed is something that happens to a lot of people.
Once I have a referral, what can I do while I'm waiting to enter the program?
One of the things I found that most patients benefit from is looking at what they drink, because a lot of us drink sugar-sweetened beverages, and you can really get a lot of extra kind of unneeded calories just from those drinks alone. And then just trying to move more. So even if you don't feel like going to a gym yet, or maybe don't feel comfortable with that, just walking more, parking a little further away from the entrance, trying to walk a little bit more each day. Those are some steps people can take, even before seeing us.
Does insurance cover this program?
Insurance covers weight loss surgery, absolutely. There are very few patients who have healthcare insurance that can't be eligible depending on their particular circumstance.
How long does the process take from referral to surgery?
Often we can get patients in the door for their first visit within weeks of the referral. After that, we really do believe that it takes time to make sure that everyone is prepared. That takes the average family 3 to 6 months to really not only get it, but to also put it into action.
How long until I can go back to work or school?
Teenagers who undergo weight loss surgery are typically out of the hospital in 2 or 3 days after the operation. They're usually back to common activities, within 2 weeks.
What kind of diet will I have following the surgery?
After surgery, you'll be following a portion-controlled eating pattern. We teach patients to use measuring cups and spoons when they're eating their meals to assure portion control. We talk about water and sugar-free fluid options and quantifying that amount with a water bottle or a measuring cup. We learn about reading labels and we practice what a portion is. So we practice mindful eating, which means that you're really present with your meal, sitting at the table as a family, not eating in front of the television or in front of the computer, which can be mindless eating because you're actually not able to tell me after you've had the meal what you've really eaten.
How can I meet and speak with a pre- or post-operative patient?
I think it's really important to talk to other people, other teenagers who have undergone the surgery before taking this on.
We also encourage parents to come to support group where they can hear from other parents and hear other teenagers talk about what's happened and how their life has changed and the good parts and bad parts about surgery.
Your family should talk to your doctor if you would like a referral to our program. Once our clinical team reviews your records, we can determine if weight loss surgery may be an option for you. For more answers to frequently asked questions, go to cincinnatichildrens.org/wait.